everybody. Welcome to Spotlight on Middle Country. My name is Lenore Paparocki, and I am the president of the Greater Middle Country Chamber of Commerce.
Good morning, everybody. My name is Alex Blend, and I work at the Miller Business Center at the Middle Country Public Library.
So Spotlight on Middle Country podcast was created to help with an alliance with the Miller Business Center and the Middle Country Chamber, and we're spotlighting our members and our community members and different events and things that happen right in our own backyard. And today I'm excited to bring to you someone who works right in our own backyard. This is Yvonne Spreckels, Director of Community Relations of Stony Brook Medicine. Yvonne, thank you so much for being here. We're so excited to have you.
Oh, it's my pleasure to be here. I love talking about Stony Brook Medicine, and I love the Middle Country Chamber. I belong to a number of chambers, and it's one of my favorite ones to be a part of. So thank you.
Thank you for that. I appreciate it.
That's awesome. That's awesome. Also, welcome, Yvonne. It's good to see you.
Thank you.
So just to start off, if you want to give us a brief introduction to yourself. How did you get to where you are today, and your position and what your responsibilities are?
Sure. So I've been the Director of Community Relations here at Stony Brook University Hospital for the last 15 years. Wow. Prior to Stony Brook, I was the Senior Director of Health Initiatives for the American Cancer Society right here in Suffolk County. My entire career, I've pretty much been focused on community engagement, educating the community about prevention and early detection of disease. I have a special interest in underserved and minority communities as well. I've worked, I started my career actually in New York City, working with youth and families at risk, a lot of immigrant populations, and so I have a special place in my heart. And so some of the work that I do here, I'm involved in community engagement, which has a lot of different things that I'm involved in. So I do everything from serving on task forces and coalitions, looking at Medicaid reform, looking at hypertension rates in the county. I'm engaged in the hospital's community service plan, and I also do direct programming, such as I run a pipeline program here at Stony Brook for underserved youth, because we've looked at the literature on healthcare disparities and know that part of the reason that ethnic and racial minorities do not have as great outcomes as the majority population. It's a complex issue, but one issue, one piece of that puzzle is that there aren't enough healthcare providers who are from racial and ethnic minority backgrounds. And so I run a program here called HOPE, which stands for Health Occupations Partnership for Excellence. And we're working with young people in high schools in Brentwood and Wyandanch and Longwood to expose these promising youth to healthcare as a career. And for the past 15 years, we've been running this program. It's free for the students to participate. The school districts are our partners, and we have students who are now today, some of them are doctors, some of them are nurses working right here in our own hospital. The gamut of healthcare careers these kids are involved in. So I'm happy that I get to do hands-on programming, such as the HOPE program, and also looking at policy related to the health of the county as a whole. So that's a little bit about me and what I do here at Stony Brook. And I'm also happy to be involved in different community organizations like the Middle Country Chamber of Commerce. I'm a board member of the Three Village Chamber of Commerce. I also serve on the Middle Country Library Foundation Trustee Board. I serve the Smithtown Industry Advisory Board. I am a member of the Combined Board and Trustee Board of Smithtown Gospel Tabernacle. I also volunteer and run a mentoring program at Smithtown Tabernacle for about 100 girls in my spare time. And I'm a mom, and I have 3 kids. And I'm happily married.
Where's the spare time there, Yvonne?
Yeah.
It comes somehow, it just kind of comes. It's funny, when you're doing a lot of different things, it doesn't seem, you don't get exhausted because the stuff that you love to do.
That's right.
And so the time is just there. I think it's, you just prioritize. And however you prioritize your time and your energy follows that.
That's exactly right. Though I just want to make a comment about the mentorship programs that you work with, because Yvonne and anybody else who knows me knows that that's something that's near and dear to my heart. And being the chairman of the Smithtown Industry Advisory Board, I'm glad you made mention of that, because it's really what you do and what you and Stony Brook Medicine and the school side, the academic side as well, with the internships is really amazing. And if anybody is interested in internships, you can actually reach out to Yvonne. Even though she's on the healthcare side, she can forward you to the right persons on
I
the.
certainly can.
So yeah. So Yvonne, you're involved in so many things. It's just I hear it and I think to myself, wow, I thought I was involved in a lot.
I can't hold a candle to you, Lenore, though. Nobody can.
But one of the things that obviously for me, especially being the president of the chamber and being in business in this area, all different types of businesses in this area, the fact of the matter is that Stony Brook, the entire complex, so Stony Brook in general, is a major economic driver for our area. Without you, you're like the largest employer, I think.
Yes, we are the largest single-site employer here.
Yes. So what other types of ways besides economically, or maybe you want to elaborate on that, does Stony Brook, how does it impact our community?
Well, certainly, we are the largest single-site employer here on Long Island, and our economic impact is over $2 billion annually. We here at the hospital employ over 7,000 workers and spend over $96 million a year in research dollars, and even and also contribute close to $300 million in tax revenue. Even though we are a state institution, we do purchase supplies just like every other business. Right. We have benefits that we have to pay employees just like every other business. And because we're here in such a large institution right here in Suffolk County, a lot of our employees live locally. And so therefore, they buy homes just like everyone else. They paint their houses, they buy groceries. They, pre-COVID especially, visit local museums, entertainment venues. They have family members that come from out of town and stay at local hotels. And so they're also contributing to the economy here.
Absolutely.
And because we have a large number of students as well, our students are very bright, very talented on undergraduate level as well as the graduate level in our health sciences school. And they want to learn, they're very bright, they want to contribute to the local community as well. So they're always looking for internships, part-time jobs, full-time jobs, anything not only to build their resume, but also to learn, what it is like to be in the world of work. In my office, I even employ student assistants as well. And it's interesting, it's funny. I was just talking to a young lady who works with me. She's a senior. Yeah, she's an undergraduate here at the university. And this is her first job in an office. And she's worked at a supermarket, but she's never worked in an office before. And when I told her that I had my very first job when I was 14, I worked in an office, and she couldn't believe that I was 14 years old and had a job. There's a different world.
Very,
yeah. So I think, I was visiting my orthodontist, and one day he said, "Do you need a job? Because I need some help." And so I spent my Saturdays working in my orthodontist's office, throughout high school. And
right.
So it's a great experience for the students, and they're very bright and eager. They have a lot to learn and a lot to share, a lot to give to employers. And so we have a wonderful career center here on the campus, and our career center utilizes a national, database where employers will simply sign in for an account, and that gives them access to not just students here on our campus, but across the country. And so our career center works very well with local businesses to provide internships for our students, as well as, people looking to employ students part-time or even full-time.
Right.
But can I just interject? We get a lot of requests at the Miller Center for, who's the largest employer on Long Island or in Suffolk County, and I always know who's going to be at number one. So for everybody who's going to be in the future seeing this and asking for that list, you heard it here first. Yvonne just told you.
That's right.
That's true. So Yvonne, you mentioned as you were speaking about COVID-19. Obviously, the Stony Brook Hospital was impacted by that. So can you talk a little bit about, your experience, or what did you hear? Because you're kind of like you're on the medical side, but you're not, because you're not the front end doctor. So can you tell us a little bit about what you might have heard, what was going on? Give us a little feel of what was happening during the height of it, and now that things might be slowing down a little bit with this horrible virus that has invaded our country. Can you talk on about that?
Sure, I'd be happy to. And so, COVID, unfortunately, we're still in the midst of it, although it's not anywhere near like what it was several months ago. But it impacted everyone. That was an all hands on deck kind of issue that we were dealing with, and no one had experience, right? Because none of us alive today, and working in healthcare anyway, were around for the last pandemic, which was over 100 years ago, right?
Right.
And so the great thing about Stony Brook is because we're an academic medical center and because we're a large research institution, we were able to not only care for patients as they came in, and by the way, we cared for over 1,700 patients through this crisis. And we not only were able to provide direct care to patients, but because we're such a large institution, we had different departments throughout campus that were looking at ways how they could help. So you may remember, there was an issue about hand sanitizer. Well, you know what? We have chemists, we have researchers. And so our chemistry department created hand sanitizer, so that we could use. So we, I think at our peak, treated 400, the most amount of patients that we had at one point with COVID was 437, and we're a 624 bed hospital. So that was pretty much every bed.
Right.
That had a COVID patient, and we still had people who had emergencies that we were treating. So in essence, we became a COVID hospital.
Right.
And so our staff obviously was working around the clock. Thankfully, we never ran out of PPE. We had members in the community who really stepped up to support us throughout. I was part of the team that was fielding calls from community members and emails to community members who, how can I help? They really wanted to help. So that we had mechanics who were calling us and said, look, I got a couple of boxes of N95s in my shop. Can you use them? We had high school students who were making face shields on 3D printers in their schools. So, and locally, the Stony Brook School is just right across the street from us. And, those students, they got together with their faculty and created shields. So the community just really came together. So we were on the front lines. And again, I'm not a clinician, so I wasn't personally taking care of patients, but we collectively as an institution were on the front lines taking care of our neighbors, our family members through the coronavirus, and the community in turn was supporting us. They were dropping off meals for our staff. I mean, even at Easter, we had a local florist that donated Easter plants and Easter baskets for our staff because they're working these tremendous hours. They don't have time to be mom and dad. It's Easter still, so maybe you couldn't go to service, but your kids were still looking for that Easter basket.
Absolutely.
And so we had folks that really stepped up and came alongside us and supported us as we work with the community. We are also, because we're a research institution, we have over 70 research projects that are going on right now, looking at ways to adjust and to help people in the long term. We noticed that, patients that had hypertension were faring worse than others. So, even in the midst of all of the tension and stress of being in the middle of this pandemic, we still have our brilliant minds who are trying to figure out, okay, how do we understand this disease? What can we do to improve the outcomes of our patients? And then long term, how do we treat them? So it was one where I do not want to repeat,
Nobody
but it's one that nobody does.
No.
But, and it's an experience that no one will ever forget, but it was one where we collectively came together, not just as an institution, but the community really rallied together. And then all the other hospitals who aren't typically used to working together, if you're not in the same system, working together. So that was, one great experience that we had here.
Right.
That really shows the great humanity that we have here on Long Island. So that's wonderful to hear. You tell us that, how the community came together. That's great. You did mention internships before. How can businesses help brighten minds about their business and get in touch? I guess, what are different ways that businesses can get involved in internships with you?
Sure. So we actually have a website, that a person can go to. So
is that the Handshake? Do you still use Handshake? Yes. Yeah.
Okay.
So we can definitely share that. I know that Handshake is what I always signed up with when I was at the Holiday Inn Express. Anybody who knows me knows I had an intern at my side all the time. I've spoken.
I could vouch for that.
I've spoken about it before. I always felt that having an intern with me always made me better because I had to be on my toes all the time because they were watching me, and with the idea of hopefully learning what I know and then emulating me and saying, okay, this is what we've got to do. Lenore already does this. This is how I do it. So I was always had to be on the top of my game. That's one of the reasons why I think internships, every business should have it because it makes you be better. But, another thing I'd like to ask you about, Yvonne, before we head out, and as you can see, it's so easy to just have conversation. And, I'm sure with you, Yvonne, without hesitation, we could go an hour.
Right.
But really quick, with my history, Stony Brook Children's has been my baby, so to speak. Here I'm going to mention my old boss, John Tunis, who was the initial chairman of the board for the concept, the idea, Stony Brook Children's Hospital. And then it came to fruition, and now it's an amazing place. Can you speak a little bit about the history, how it came about, how it evolved? Again, near and dear to my heart. I've done a lot of work, as you know, to help support the Children's Hospital, because I feel that having a Children's Hospital in our own backyard is the best thing we can do for our community.
It absolutely is. And I have to tell you that it's one where, Stony Brook, we've had throughout our history, pediatrics, right? And then before we became a hospital, we already had 100 pediatric beds before we became an official children's hospital. And so, but the reality of it is the need is great. Suffolk County alone has 1.5 million people. And even though we're very close to a large city, there really wasn't there actually was no children's hospital in Suffolk County, period.
Right.
The closest one is really on the Nassau-Queens border. So if you live in Suffolk County, or even, Eastern Nassau for that matter, that's a hike. And not only is it a hike, people could say, well, I drive to Queens, pre-COVID, right, every day, or, I take the train, and, it's no big deal to commute. But when you have a sick child, you don't want to spend an hour and a half or 2 hours on the road when your child is sick.
Absolutely not.
You don't want to spend the money, or some people don't even have the money for a hotel nearby a children's hospital. And
all the gas too as well.
Right. We have excellent care here at Stony Brook, and we said, Stony Brook is a resource for our community, has always been since the day the hospital opened in 1980. And we need to really expand our services to meet the need of our population here in Suffolk County, which continues to grow. And so a couple of years ago, we were able to, thanks to folks like Don Tunis and lots of NAPSPs and lots of great donors in the community, we were able to open a 71,000 square foot facility, which is beautiful. It's not just beautiful because of its architecture, but it was really designed for kids and their families. And so it's a kid-friendly place. We're here on Long Island, so the theme is nautical. So we've got, firehouses and sand, and we're live feed into the aquarium, and things that are making being in a hospital not so threatening to children. We have phenomenal pediatric specialists here as well. And our child life specialists really try so hard to make the experience of being in a hospital not so scary for kids. And it's home, it's close to home. And so if
Right.
you live here in Suffolk County, you can get excellent care for your children and not have to have the stress of being so far away. We also have a partnership with Ronald McDonald House, who has been wonderful in providing respite and family rooms for our pediatric families so that they can be here and they can get a shower, they can get a hot meal. They need to just step away from the bedside, but not be so far away. And then hopefully in a few short years, we'll actually have a full-fledged Ronald McDonald House right here on the campus, again, providing care for families as they're caring for their little ones. And pediatrics isn't just, infants too. We go up to pretty much 21 years old. And so we're so happy that we are able to provide the service to our families of pediatric patients here, right here in Suffolk County. And we could not have done it without the support of the community and their generosity.
That's for sure.
If I just like to say, I mean, it's awesome how you mentioned the fire hydrant and the live feed into the aquarium, because not only is it the child who may be sick, but they may have siblings, and their siblings might be spending more time than their parents want them to in the hospital. And so it's a good distraction for their siblings to have as well.
Absolutely.
So that's a really great thing.
Yeah, very good. So, Yvonne, as I had said, we could go on forever. A really, really very interesting conversation. I so enjoyed it. And if anybody wanted to reach you, how would they go about doing that?
Best way is by email, believe it or not. Again, I'm a dinosaur, so I like email. So which is simply my name, which is Yvonne, Yvonne, .Spreckels, and you can put that up on the screen also at the end.
Yes.
Spreckels at Stony Brook Medicine.edu. I view my role here at Stony Brook as a way to connect the resources of our incredible institution with folks in the community. So that's what I'm here for. So, and I'd be remiss if I wouldn't give a plug. We're for a flu season is coming up. We're really trying to educate people about getting their flu shot. With COVID, we're very concerned about that. So the last thing we need is to have people with the flu and then also people with COVID, in our hospital. So we want people to stay safe and not get sick this fall and this winter. And so we're always just trying to educate the community and give them resources. So I'd be happy to help anyone. And I also need to mention too, even with Middle Country Chamber, I've also worked with the Chamber and students from the local high school, Center Reef and Newfield, and having them come into the hospital. Of course, this was pre-COVID, but for the Career Exploration Challenge. And so, if there are school districts or community-based organizations that are looking to connect to us here at Stony Brook Medicine, I'd be happy to be that contact person for them. And if it's not me directly, I kind of have a Rolodex in my head that there's someone at Stony Brook who will probably help you. I'd be more than happy to connect those dots for you.
Fantastic.
That's awesome.
That's awesome. That is awesome. Thank you, Yvonne. We really appreciate having you here today. And you were just a wealth of information. And I really enjoyed speaking with you and get to know you a little bit better. And, hopefully we're come out of this whole COVID-19 quickly with, just continuing that downtick, praying. And I know everybody else is that this thing ends fast and we don't have any more deaths associated with it. It's been a very hard last 6-7 months. And everybody that I know, everybody has to know someone who's been impacted by it, and it's a shame. But in any case, on a high note, it's been great to have you here, and we will talk to you again soon, I'm sure, because you have so much more to share. Alex, thank you for hosting with me today. I really
it was a pleasure. It was a pleasure. Thank you for hosting with me, and Yvonne. Again, it was great to see you. And talk with you and learn more about what you do and your history and about the University Hospital. Thank you so much.
It's a pleasure to be with you here, Lenore and Alex, and thank you so much for having me. It's great to spend time with the two of you.
Pleasure.
Take care. Thanks.
Okay,
Bye-bye, everybody.
Bye-bye.